Um, Daniel, Antics, an
Uh,
interactive game for exploring adaptive trial design. Very
That's
consultant.
right.
Thanks, Daniel.
Yeah. Yeah. Thanks for the flexibility. I think there was some switching with the speakers. So I am obviously not Jenna. Daniel Woodie here. And hopefully this is um, a nice kind of change of pace. I'm going to be talking about um, it's a game, but it's a game we use for trainings and educational purposes, and we built it with R Shiny. So I, I only have just a few minutes, so I'm going to try and really just jump right to the demo, but just for there's so there's some context here. Um, uh, so Berry Consultants works a lot with adaptive trial designs, and it can take a lot for clinical study teams to gain some intuition about working with um, adaptive designs. And so we put together this kind of game style tutorial to help in training people that work on these kinds of studies. Um, and I will be jumping into the demo. One thing to point out is that this quote unquote game is a free public R Shiny tool that's available to anyone. And I will share the link in these slides. But yeah, I will just jump over to it. And for a little bit of context, I'm going to be doing not a stage design, a dose finding one, and then I'm going to demo a little Bayesian assistant that I added to it. Alrighty, so here is the landing page for it. Again, I'll share the URL. If you're quick with typing, it's just shiny.berryconsultants.com /antics. And so we can start playing. And as you will see right here, there's a few different modules. In general, we tried to get these modules to kind of map to end-to-end phase 1, 2, and 3 trial design types you might come across. So we have dose escalation, just really focused on finding the maximum tolerable dose, which I understand maybe they may be adding some more complexity to dose escalation studies, dose finding, which is what we'll be doing today, population enrichment, or looking at subgroups. And then we also have a stage design one, which looks at phase 2 and phase 3 stage design. So for dose finding, I'll select this. I will put my, I was testing it out this morning, my team name, Dances with Wolves. And let's go here. So here's our crawl screen, Star Wars inspired, JavaScript under the hood, but it's kind of prepping the user for what they're about to go through at a very high level. You're going to have to make a go or no go decision. If you're actually playing this, you can click replay if you didn't get all of that. I'll start over, but for the interest of time, I will just get started. Again, so we have rules here and scoring. I will go over the rules. The scoring, there's a lot of detail there and a lot of nuance. And it kind of, we tried to put the scoring in a way that maps to a lot of the kind of emotional side of running a dose finding study for whatever that may be. But for the rules, So you're going to have 200 subjects to allocate over 4 interims. Your goal is to make a go or no-go decision. If it's a go, you get more points for recommending the right dose or the highest dose. And we won't be focusing on safety events today. I'm going to pick one that doesn't have safety events, but you need to pick a dose that has 10% or more efficacy advantage. And for getting that, you get 2,000 points. Alrighty, and so now we have 6 different trials to pick from. Each of these have different distributions under the hood. And we did that so that it's useful for training, so that instructors can know what the distributions look like under the hood. Alternatively, if you're just interested in testing out random distributions, you have that option as well. It's more for the game style piece of it. I will begin with that first scenario. And probably if I just start playing, that's better than explaining everything. But right now I'm allocating subjects for my first interim. I have 200 over 4 interims. I'm just going to, and here's, in this case, we have a control and 9 doses going from 10 milligrams up to 100 milligrams of some arbitrary drug in this case. And so what we're going to do for this first interim is just kind of uniformly assign 4 subjects to each group. And now we'll run the interim. And what we get at the interim is we get to see how many subjects we allocated. So this is just playing back what we were just looking at. We get to look at efficacy and safety events. For this, really you can just ignore the safety part. It's just going to be at 0, but do be aware for some of the other trials there are safety events, and so it makes the decision making a bit more complex. And so for efficacy, what you're looking for is really, so you have your control right here, and after enrolling 4 subjects, you've got 25% efficacy. And then what you're looking for is greater efficacy. So the higher the dots, the better that dose is, at least for this interim. And then over here, you have a table just that's displaying everything that's happened in the data so far. So again, if the efficacy for the control is 0.25, then minimally we're looking for 0.35. And in this case, you could probably argue with 4 subjects in each group, you should just keep on enrolling. And so I will continue here and enroll 4 more subjects. And for each of these, additionally, what we'll see now is you may want to adjust your allocation. Yeah. So for this, we may want to say, okay, it looks like this 70 to 100 range is not, we're not seeing the efficacy we're interested in, so we may want to cut out those doses. And similarly, this 10 to 20, so we may just want to allocate 30 to 40 or 30 to 60 in this range right here. And so again, we'll allocate to control. And in this case, we'll just do 10 for each. And yep, and so now we've allocated a lot more, And what we're seeing is the control kind of converging towards 0.33. And then we have 30 and 40 milligrams looking like they're performing pretty high. And so what we can do now, we could continue to enroll, but let's be a little bold here. Let's just jump for this 40 milligrams and say, let's make a decision. You could go with 2 doses. I'm just going to go for 1 with this example, and then we can lock in our decision. And so here we are with our score. Again, I'm not going to go into the details of everything going on with the score. The important thing here is right here with our observed versus real efficacy. And so what you see down here is the actual data, which was not always performing like the real distributions, which are displayed in triangles. So all it is under the hood is just running our binom with the parameter value set to some pre-specified value that you can see right here. And so this is also kind of a good lesson in kind of the stochastic nature of data. But yeah, so that is one run through. Real quickly, I'm going to show you something cool on top of this that we built. And then I will try and wrap it up very quickly. So let's say we're starting a trial fresh. We can run our first interim here. So it starts over everything. And over here, I have cheat codes. And I cannot remember it exactly. Let me see if I get it right. All right, cool. So I got it right. So I typed in capital B Bayes. And so what I've unlocked now is Bayesian model averaging. And I call this little thing a Bayesian assistant. And so what's happening under the hood is there's a Bayesian variation of MCP mod where it attaches Dirichlet prior to multinomial weights for kind of a handful of different models. And those models as well are also, you can attach uninformative priors to them. But you can take the data that you just got for that interim, pass it through, and then use posterior probabilities to assign weights to your allocation here, if you're interested in doing something like that. In this case, we've set a fixed rule for allocating to control, just to make sure our power is still steady throughout this assistant. So anyway, I will run one more interim here, but I'm guessing I'm getting a little close on time. So
yeah,
yep.
we actually might be stressing your server out a little bit too, over 500 people. That was pretty cool. Having the chat thread is pretty awesome in terms of what's coming out of this app, and it's the fact it's
cool.
is wonderful, Daniel. So thank you again for sharing this.
Yeah, definitely.
If you have any questions with Daniel, please make sure to get in touch with him on the side thread, and I'm sure it's overloaded right now. I know that for sure. So if make sure to check it out later on when the usage is a little bit lower. So thanks again. Thanks again.
Yeah. I didn't anticipate that. I should have told our IT guy. He won't be happy with me.
Somewhere there's a spike. Okay. Okay.
Yeah.
Thanks again, Daniel.